Wake up multiple times at night just to empty your bladder. You are not alone. Millions of people across the world face this exact problem every single night. But what if I told you that frequent nighttime urination could be pointing to something much more serious than just drinking too much water before bed? This video is for information purposes only. It is not medical advice. For any health concerns, please consult a qualified doctor. Let me start by explaining what this condition actually is. When you wake up 2 or more times during the night to urinate, we call this nocturia. This is not just an inconvenience. It is a medical condition that deserves attention. Your bladder is designed to hold urine for several hours at a time. During sleep, your body produces less urine than during the day. This happens because of a hormone called vasopressin. This hormone tells your kidneys to make less urine at night so you can sleep without interruption. But when this system does not work properly, your body continues to produce large amounts of urine even while you sleep. This forces you to wake up repeatedly throughout the night. The impact on your sleep quality can be devastating. Let me explain the most common reasons why this happens. Age is one of the biggest factors. As you get older, your bladder capacity naturally decreases. The muscles in your bladder wall become weaker and less elastic. Your body also produces less vasopressin as you age. This means your kidneys do not get the signal to slow down urine production at night. Many people over the age of 60 experience this problem on a regular basis. But age is not the only cause. Medical conditions play a huge role in nighttime urination. Diabetes is one of the most significant contributors. When your blood sugar levels are too high, your kidneys work harder to filter out the excess glucose. This process pulls more water from your tissues and creates more urine. If you are waking up at night to urinate and also feeling extremely thirsty during the day, this could be an early warning sign of diabetes. High blood pressure is another major cause. When your blood pressure is elevated, it affects how your kidneys regulate fluids. Your body may produce more urine to try to reduce the fluid volume in your blood vessels. Heart failure can also lead to nocturia. During the day, when you are upright, fluid can accumulate in your legs and feet due to gravity. When you lie down at night, this fluid returns to your bloodstream. Your kidneys then work to remove this extra fluid, causing you to urinate more frequently. Urinary tract infections are a common trigger as well. When bacteria infect your bladder or urethra, the lining becomes irritated and inflamed. This makes your bladder more sensitive and reduces its capacity to hold urine comfortably. You may feel a strong urge to urinate even when your bladder is not full. UTIs often come with other symptoms like burning during urination, cloudy urine, or pelvic discomfort. For men specifically, prostate problems are a leading cause of nocturia. The prostate gland surrounds the urethra just below the bladder. As men age, the prostate often enlarges in a condition called benign prostatic hyperplasia. This enlarged prostate squeezes the urethra and partially blocks the flow of urine. Your bladder has to work harder to empty itself. It may not empty completely, leaving residual urine that makes you feel the need to go again shortly after. Sleep disorders like sleep apnea also contribute to nighttime urination. When your breathing stops and starts repeatedly during sleep, it causes changes in pressure inside your chest. This triggers your heart to release a hormone that increases urine production. People with sleep apnea often wake up to urinate without realizing that their breathing problem is the root cause. Treating the sleep apnea can significantly reduce nighttime bathroom trips. Overactive bladder syndrome is another condition where the bladder muscles contract involuntarily. This creates sudden and urgent needs to urinate, even when the bladder is not full. This can happen both during the day and at night. Now let me talk about lifestyle factors that contribute to this problem. What you eat and drink has a direct impact on your bladder behavior. Caffeine is a strong diuretic. It makes your kidneys produce more urine. Drinking coffee, tea, or energy drinks in the evening can easily lead to multiple nighttime wake-ups. Even if you only have 1 cup, the effects can last for several hours. Alcohol also increases urine production. It suppresses the release of vasopressin, the hormone that helps you retain fluids at night. This is why people often wake up needing to urinate after drinking in the evening. Foods that are high in salt cause your body to retain water during the day. When you lie down at night, your body works to flush out this excess sodium in water, leading to increased urination. Drinking large amounts of water or other fluids right before bed is an obvious contributor. While staying hydrated is important, timing matters. If you consume most of your fluids late in the evening, your bladder will fill up during the night. Certain medications can also increase nighttime urination. Diuretics, which are often prescribed for high blood pressure or heart failure, are designed to help your body get rid of excess fluid. If you take these medications in the evening, they will cause you to urinate more at night. Some antidepressants and medications for Parkinson's disease can also affect bladder control. Always discuss the timing of your medications with your doctor if you notice increased nighttime urination. Let me explain why this condition is more than just an annoyance. Interrupted sleep affects every aspect of your health. When you wake up multiple times each night, you do not get enough deep sleep. This is the restorative sleep phase that your body needs to repair itself. Chronic sleep deprivation weakens your immune system. It makes you more vulnerable to infections and illnesses. It also affects your mental clarity and concentration during the day. The constant fatigue can lead to mood changes, irritability, and even depression. Your productivity at work suffers. Your relationships may become strained because you are always tired and not functioning at your best. There is also a significant safety risk. Getting up multiple times in the dark increases your risk of falls. This is especially dangerous for older adults who may already have balance issues or weakened bones. A fall in the middle of the night can lead to serious injuries like fractures or head trauma. Many hip fractures in elderly people happen during nighttime bathroom trips. Now let me share the new routine that can help you manage this condition effectively. The first step is to practice timed voiding during the day. This means urinating on a schedule rather than waiting until you feel a strong urge. Start by going to the bathroom every 2 to 3 hours during the day, even if you do not feel the need. This helps train your bladder to hold more urine and reduces the sensitivity that makes you feel urgent needs. Gradually increase the time between bathroom visits. This bladder training technique can significantly improve your bladder capacity over time. It takes patience and consistency, but it works. The second important step is fluid management. Instead of drinking large amounts of water at once, spread your fluid intake evenly throughout the day. Try to consume most of your fluids in the morning and early afternoon. Start reducing your fluid intake about 3 hours before bedtime. This gives your body time to process the fluids before you go to sleep. Your bladder will be less full when you lie down. However, do not restrict fluids too much. Dehydration can actually irritate your bladder and make symptoms worse. The goal is smart timing, not severe restriction. Limit or eliminate caffeine and alcohol, especially in the evening hours. Switch to herbal teas or water after lunchtime. If you do consume caffeine, have it in the morning so your body has the entire day to process it. The third step involves pelvic floor exercises. These exercises strengthen the muscles that support your bladder and control urination. They are often called Kegel exercises. To perform these exercises, you squeeze the muscles you would use to stop urinating midstream. Hold this contraction for 5 seconds, then relax for 5 seconds. Repeat this 10 times, 3 times a day. Over several weeks, you can increase the hold time to 10 seconds. Strong pelvic floor muscles give you better control over your bladder and can reduce urgency and frequency. The fourth step is elevating your legs during the evening. If fluid retention is contributing to your nocturia, this simple technique can help. Lie down and prop your legs up on pillows for about an hour in the late afternoon or early evening. This allows the fluid that has accumulated in your lower legs to return to your bloodstream. Your kidneys can then filter it out before bedtime rather than during the night. The fifth step involves double voiding. This technique is especially helpful if you have incomplete bladder emptying. When you urinate before bed, stay on the toilet for a moment after you finish. Relax, then try to urinate again. This ensures your bladder is as empty as possible before you go to sleep. It can reduce the likelihood of waking up shortly after falling asleep. Pay attention to your sleeping position as well. If you sleep on your back, consider switching to your side. Side sleeping can reduce pressure on your bladder and may decrease nighttime urination for some people. Create a clear path to your bathroom. Remove any obstacles or tripping hazards. Use night lights so you can see where you are going without turning on bright lights that can make it harder to fall back asleep. Keep your bedroom cool. A warm environment can increase urine production. A slightly cooler room temperature may help reduce the frequency of nighttime urination. Now let me talk about when you should see a doctor. If you are waking up more than twice per night to urinate, it is time to get evaluated. If the problem has started suddenly or is getting progressively worse, do not wait. If you notice blood in your urine, pain or burning during urination, or if you are unable to urinate despite feeling the urge, seek medical attention immediately. These could be signs of infection, stones, or other serious conditions. Your doctor will likely perform a physical examination and order some basic tests. A urinalysis can check for infections, diabetes, or kidney problems. Blood tests can reveal issues with kidney function or electrolyte balance. For men, a prostate exam may be necessary to check for enlargement or other abnormalities. Women may need a pelvic exam to assess for prolapse or other structural issues. Your doctor may ask you to keep a bladder diary for several days. You will record how much you drink, when you drink it, how often you urinate, and how much urine you produce each time. This information helps identify patterns and potential causes. In some cases, additional tests may be needed. These might include ultrasound imaging of your bladder and kidneys, or urodynamic testing to measure how well your bladder stores and releases urine. Treatment will depend on the underlying cause. If diabetes is the problem, managing your blood sugar levels will help reduce urination. If high blood pressure is the culprit, better blood pressure control can make a significant difference. For men with enlarged prostates, medications can help relax the prostate and improve urine flow. In some cases, surgical procedures may be recommended. If overactive bladder is diagnosed, medications called anticholinergics or beta agonists can help calm the bladder muscles and reduce urgency and frequency. For cases related to low vasopressin levels, a synthetic version of this hormone called desmopressin can be prescribed. This medication helps your kidneys produce less urine at night. However, this medication is not suitable for everyone and must be used carefully under medical supervision because it can cause serious side effects if not monitored properly. Some people find relief through alternative approaches like acupuncture or biofeedback training. While the scientific evidence for these treatments is limited, some patients report improvement in their symptoms. The most important thing is to not ignore this problem or simply accept it as a normal part of aging. While nocturia becomes more common as we get older, it is not inevitable and it is often treatable. Quality sleep is essential for your overall health and well-being. Every time you wake up at night, you disrupt your sleep cycle. Over time, this chronic sleep interruption can have serious consequences for your physical and mental health. By implementing the routine I have described, many people see significant improvement within a few weeks. The combination of bladder training, fluid management, pelvic floor exercises, and lifestyle modifications can be very effective. Remember that consistency is key. These techniques work best when practiced regularly over time. Do not get discouraged if you do not see immediate results. It may take several weeks for your bladder to retrain itself. Track your progress by noting how many times you wake up each night. As you implement these changes, you should gradually see the frequency decrease. Even reducing nighttime bathroom trips from 4 times to 2 can make a huge difference in your sleep quality. Discuss all your symptoms with your doctor. Be honest about how this problem is affecting your life. There is no need to feel embarrassed. Nocturia is a common medical condition that doctors deal with every day. Your doctor needs to know the full picture to provide the best treatment plan. This includes information about your medications, diet, fluid intake, and any other health conditions you have. If your first treatment approach does not work, do not give up. There are multiple options available. Sometimes it takes trying different strategies or combinations of treatments to find what works best for your specific situation. Be patient with yourself during this process. Changing long-established habits and retraining your bladder takes time. Celebrate small improvements along the way. The impact of better sleep cannot be overstated. When you start sleeping through the night without interruptions, you will notice improvements in your energy levels, mood, concentration, and overall quality of life. You will wake up feeling refreshed and ready to face the day. Your relationships will improve as you become less irritable and more present. Your work performance will benefit from better focus and mental clarity. The safety benefits are equally important. Reducing nighttime bathroom trips means fewer opportunities for falls and injuries. This is especially crucial for maintaining independence as you age. Remember that your bladder health is connected to your overall health. Taking care of this issue often reveals other health problems that need attention. Addressing nocturia may lead to better management of diabetes, heart disease, or other conditions. Stay hydrated during the day, but be strategic about timing. Maintain a healthy weight, as excess weight can put pressure on your bladder. Exercise regularly, as physical activity supports overall bladder health. Avoid foods and beverages that irritate your bladder. Besides caffeine and alcohol, this can include spicy foods, citrus fruits, artificial sweeteners, and carbonated drinks for some people. Practice good bathroom habits. Do not rush when you urinate. Take your time to fully empty your bladder. Do not hover over the toilet seat, as this prevents complete bladder emptying. Manage stress, as anxiety and tension can worsen bladder symptoms. Relaxation techniques like deep breathing, meditation, or gentle yoga may help improve bladder control. If you smoke, quitting can help. Smoking irritates the bladder and increases the risk of bladder cancer. It also causes chronic coughing, which puts stress on your pelvic floor muscles. Waking up frequently at night to urinate is not something you have to live with forever. With the right approach and proper medical guidance, most people can find significant relief. Take action today by starting the routine I have outlined. Keep track of your symptoms and progress. Work closely with your healthcare provider to address any underlying health issues. Your sleep matters. Your health matters. Do not let nocturia continue to disrupt your nights and diminish your quality of life. The solutions are available and effective for most people. So if you like this video, please like and subscribe for more videos like this.